Mr. Chair, and thank you everyone for coming in and attending today. Commander Sarmiento and the rest of the veterans of foreign wars of the United States for coming to Washington, D.C. to testify today. I look forward to having representatives from the Montana chapter of the VFW in my office later today, and I always appreciate your perspectives and insight on all the veterans issues. In your written testimony today, you stated adopting a value-based healthcare model would allow for a patient system-centered system that aligns with the VA's whole healthcare approach. Helping lead the charge on a bill that would establish a pilot program to allow veterans to receive a health savings account and use the money to obtain medical services through a direct primary care arrangement. The legislation would make it easier for veterans to see their doctor and spend money on preventative measures to improve their health before getting sick. I was the insurance commissioner of Montana from 2016 until 2020, and I'm proud to say that I was able to get authorized direct primary care agreements between private individuals and doctors, physicians, for a very low cost. And not only have we received incredible response from the patients themselves, but from the doctors that are delivering that care. They have a much more close and intimate relationship with the physicians. So it has been working out extremely well for everyone involved, and has been able to address some of these issues that are chronic conditions like high blood pressure and diabetes, so that we make sure that we have a good maintenance program in place. What I would like to ask Commander Sarmiento is, what ideas do you have to make the care at the VA more patient-centric?
So I'm going to pass, our executive director, definitely a little better at this than I am.
Okay.
I'm going to pass this off to Ryan so I don't sit here with an answer and try to dance around you and go, obviously you want your question answered.
Perfect.
Well, thank you, Commander-in-Chief, and thank you, Mr. Rosendale, for the question. The VFW has had a lot of discussion on this very issue. Now first, to be perfectly frank, when Phoenix happened in almost a decade ago, we were out there saying, look, community care is part of VA care, and that's very important. What we've seen over the last 10 years is you've had the Choice Program, now you have Mission Act, you've had other programs here or there. One thing, here's what I'm concerned about. The Secretary talks about how much VA is spending on community care, but you look at how much of that is emergency room care. That is the most expensive and most fractured care that a veteran can receive. Some of the things that we've talked about with Dr. El Nahal and VHA and even the Secretary is you need to lean on your third-party administrators. You need to lean on your third-party administrators heavily so that you're integrating this community care into VA care when a veteran has chosen VA as their care provider. We're pushing that very hard because the last thing we need is veterans showing up at emergency rooms receiving that fractured care. We think there are ways to do this and would be eager to work with you and the committees to address that.
Thank you very much. And again, I think that we can establish this relationship. We have a maintenance program that we can avoid crisis situations for our veterans in the future. Thank you, Mr. Chair. I yield back.